Life-saving advice about underage drinking.
Experts say every parent needs to know the signs of alcohol use, abuse, and poisoning. Joining us now, Dr. Scott Hadland, who is Chief of Adolescent Medicine at Mass General Brigham for Children. Dr. Hadland, good to see you.
Good to see you too.
Yeah, always great to have you here. So you speak with a lot of young people, certainly adolescents. How easy is it for them these days to access alcohol? I imagine very easy.
Right. Well, on the one hand, actually, if you look at national survey data of high school seniors, the percentage that report that it's easy or fairly easily to get a hold of alcohol is actually at a low right now.
That's good.
But it's still 75%, which means that 3/4 of high school seniors say that it's easy to get alcohol. Where are they getting it from? Well, actually, if you look at Massachusetts survey data, high school students in Massachusetts, number one, they get it from parties. Number two, from friends. Number three, they get it from home. And number four, it's an adult buying it for them. So that gives you a sense of where the alcohol is coming from.
So what should parents do if they suspect that their child has been drinking?
Well, I think the first thing is you want to make sure that your child is safe, right? Safety is always number one. And so if you have concerns that they're losing consciousness or having a tough time breathing, or if they're really sick, throwing up a lot, absolutely you want to make sure that they get medical attention. Now, that's going to be, I think, a pretty rare circumstance, but it's really important to act if that does happen. Call 911, get your child to the emergency department. I think the bigger point for parents, though, is what do you do in between those times, right? It's actually the moments where your teen's not actually actively drinking that you want to be having the conversations that help keep them safe, right? So I recommend parents have lots of frequent, early conversations in which they're asking curious questions. Are your friends drinking? What are you seeing? What would you do if somebody offered you a drink? Is there a way that you would feel comfortable saying no? Let's practice that together. And then actually having parents make a clear recommendation to teenagers. Look, I don't want you to drink because that's the best decision for your health and safety.
All right, well, you were talking if you notice your child has these symptoms, they should see a doctor. But how do you know the difference, though, between kind of drinking little too much and truly alcohol poisoning?
Right, yeah. I mean, parents' intuition, if you're ever worried, it's never wrong to get medical attention for your child. So absolutely, if you're worried, just, call 911, go to the emergency department. Having said that, the real signs that we're looking for when we're trying to make the diagnosis of alcohol poisoning is there severe vomiting going on? Is there loss of consciousness? And of course, this is dangerous, not just because it's dangerous in and of itself, but, you can have an injury or a fall if you're losing consciousness. And so even a teenager who might go to bed, getting up in the middle of the night if they're getting dizzy and they have a fall and they hit their head, there are serious things that can happen when somebody has been drinking a lot. And so these are the things that we're looking out for.
And then what happens at the hospital?
Yeah, there's sort of this old trope that, they're going to pump your stomachs, right?
That's what I was going to ask you. Is that do they still do that?
We don't actually. So the care that we're providing in the hospital is really supportive. So we're keeping an eye on teens or young people who have been drinking, making sure that their electrolytes are safe, making sure that they regain consciousness safely, and that their airways are, patent and, they're able to breathe and not have any problems and be safe and recover safely.
Okay, Dr. Scott Hadland, as always, thanks for joining us. Have a great weekend.
You too.
Safe weekend.
Thank you.